Welcome back to the Afterword, a conversation about the future of words. We're glad to have Dr. Andrew Budson from a whole host of institutions that he's affiliated with, and Dr. Christy Tangney from Rush University in Chicago. And we are in the middle of a riveting conversation about the brain, about memory, and about what we can do to remember better and to maintain our cognitive health into old age. And speaking of old age, let's talk about aging and the brain. I think most people's greatest fear about growing old is the possibility of getting dementia. What is dementia? Is getting dementia inevitable? And maybe once we get past those two questions, we can talk a little bit more about what puts us at risk of dementia, what we can do about it. But let's start with that. Let's go in a little more detail than we did at the beginning of the last episode into what is dementia and is it inevitable?
So maybe I'll start. So we talked in the last episode about the fact that most dementias are caused by Alzheimer's disease. It's the most common type. And the word dementia itself means that thinking and memory have deteriorated to the point that it interferes with daily function. And maybe, Holland, I can just spend 2 minutes talking about the changes in memory that occur as part of normal aging and how those changes are different from the changes that occur in Alzheimer's disease. So I want to give your listeners a filing system analogy as to how our memory works. So the first part of this filing system is the file clerk, and it's the file clerk's job to pull information in from the outside world and to put it into the file cabinet. Now, the file clerk is actually a part of our brain. It's our frontal lobes right behind our forehead. And so all this is very good, but guess what? As we all get older, our frontal lobes are getting older too. And I'm going to continue with this analogy to tell you 3 things that happen to our older frontal lobe file clerk just as part of normal aging. So again, this is an analogy, but the first thing that happens is our older frontal lobe file clerk does not hear quite as well as she used to. And because of that, information may need to be repeated a couple of times in order for the file clerk to get a hold of it and put it into the file cabinet. Second thing that happens to our older frontal lobe file clerk is she does not move as quickly as she used to. And so it may take her a little bit longer to retrieve a memory. The third thing that happens is she does not see quite as well as she used to. And because of that, she may need a hint or a cue in order to find the information that she's looking for. But importantly, as part of normal aging, as long as the information made it into the file cabinet, it should be able to be retrieved, even if it takes a little bit of time or a hint or a cue. Now, in Alzheimer's, the problem is actually with the file cabinet. So the file cabinet's another part of our brain. It's actually the hippocampus, which is deep in our temporal lobes, okay? And in Alzheimer's, we have this pathology, these plaques and tangles that end up damaging and ultimately destroying the hippocampus. And the way I think about it, imagine if you pulled open that file cabinet drawer and you looked down inside, you would see a big hole in the bottom of the file cabinet. Well, if there's a hole in the bottom of the file cabinet, you could have the best, most efficient file clerk in the world pulling the information in from the outside world, putting it into the file cabinet. But what would happen? It would disappear down the hole, never to be retrieved again. And when that happens, even when information is repeated, even if you wait a bit of time or you give a hint or a cue, you cannot retrieve that information. And we call that rapid forgetting. And rapid forgetting is never normal. If any of your listeners or their family are suffering from this rapid forgetting, it should always be evaluated.
I love that analogy. Fantastic.
We love analogies, don't we, Helen? This is right up the Afterword's table, if you will.
So let's take this a little further. Now we know what dementia is. We know what normal cognitive decline in aging is. What can we do about it?
There's a lot of things we can do about it, of course. What we know at this point is that we get a fairly positive signal from exercise, particularly aerobic exercise. We see a really fine signal with aerobic exercise. The question is how large the dose is for everyone to achieve a improvement in cognitive performance or to delay that decline. And that may be uniquely different for each individual. And so most of the trials thus far have, I would say, tried to create a very strong signal. And it may be not needed that strong, but nevertheless, when we look at the trials that have been done that have been most successful in actually altering decline, it is often in countries where they're much more active than Americans are, I have to say. So the big ask among Americans is to get to that point. So when we look at the Finns and the Norwegians, their activity level, at least as far as minutes per week, are much higher. They're like on the order of 200 and 300s for most individuals. And we right now are trying to get people to go to 180, and that is very difficult. But for many, that's been successful in preventing diabetes. It's been successful in helping heart health. And we have seen some preliminary studies to say, yes, especially aerobic activity is much better than stretching and balance. Not to mitigate the role of those things, but as far as the intensity of the signal, it's much better. And a lot of that work is done by people like Dr. Baker and others. There have been a number of studies looking at this. Then the other piece is potentially diet. And those diet behaviors are things that are very consistent with the messaging that we've heard, Mediterranean, DASH, or the MIND diet. So those kinds of dietary patterns, vegetarian, healthy. There can be unhealthy vegetarians too. So it is understanding what is healthy and typically what's minimally processed, because our food supply is so processed in that capacity that we have to make wise choices. And that's one of the other things. And then the other piece is something that we've already discussed in the first episode, that is social engagement. That's something that has to be there. Brain activity might contribute, but that data is never as strong as the social engagement evidence that's out there. And much of that comes from observational trials, some short-term randomized trials. And then, of course, there are those trials in which they take all of those things in order to create a large enough signal to see some real change in performance.
So Christy, vegetarian diet, you mean like French fries, regular pasta, white bread? Is that good for a vegetarian diet?
Well, and you're just triggering the moment, because in fact, those are the kinds of things that we don't want. We want foods. I mean, there's nothing wrong with a baked potato. There's nothing wrong with a simple baked potato. But if we had a choice, the things that are best in the vegetable category, at least at this point. Now, again, the evidence is associative, and we'll learn a little bit more in the next year or two from the trial data. But green leafy vegetables. So the minimal processing, like eating a salad 3 or 4 times a week, is an excellent thing to do. You're getting leafy greens, minimum processing. On top of it, you add olive oil and vinegar, but you don't have to buy those salad dressings. You use the simplest ingredients, extra virgin olive oil, and you get a big bang for your buck. you sprinkle a few nuts on. Here's the other thing is we can do things simply. People are hungry in the middle of the day. Have some pistachios, have some almonds. You don't have to have that confection, that crackers, those things that are, anytime I tell participants, if you can't read the ingredient label and you have more than 3 or 4 things in that label, get rid of it. Get rid of it. Of course, there is a special moment where you might have it, but it's so much better. And I think the thing that COVID has taught us is we can eat well at home. We can eat well at home. So I actually think there's the part about COVID that has been the most challenging for most older adults is that social isolation,
Yeah.
But we can still exercise. We can still walk around the block. We can still do those kinds of things. We can still get on a bicycle. We need to do those kinds of things. And that is really important.
So good.
Yeah. So I do think those things are there. I think how much they is we still need to learn a lot more.
Okay. Well, you've kind of segued a little bit into COVID since you brought that up. Let's talk about COVID because this is the order of the day. We do know that the social piece has been a huge concern. I know students and teachers in this place of isolation, and we're looking at how do we now re-enter society well, being in isolation. But what do you know about the actual, that we've heard this COVID fog or this COVID brain type thing? What is some of the experiences that you're hearing about COVID and our brain's health, and can that be regenerated?
I'll let Andy do that one.
Yeah. I'll talk at least first about this. So there are a lot of different ways that the virus can directly damage the brain. And then there are ways that it can impair brain function through other organs. And of course, just being in social isolation can also lead to depression, anxiety, loneliness, which can also interfere with cognitive function. And I'll just touch base very quickly on all of those. So if the virus actually attacks brain cells, which is not common but has happened, it causes encephalitis. And so encephalitis and inflammation of the brain can damage the brain directly, and it can be a little bit of damage or it can be lethal. Another thing that happens all too commonly is I think we all know that COVID most of the time it affects the lungs. People get a COVID pneumonia, they have trouble breathing, and the part of the brain that we've been talking about, that file cabinet, the hippocampus, is exquisitely sensitive to oxygen. And if our levels in our oxygen in our blood drop, it can damage the hippocampus and we won't be able to form new memories, or it'll be much more difficult to do so. And then the third way that COVID damages a lot of people's brains is it predisposes them to strokes. And it is a particular problem for older adults who are prone to strokes anyways. But COVID can double, triple, quadruple, maybe 10 times the risks of having strokes. And for someone young, maybe that means they go from like 1 in, say, 10,000, to 1 in, 1,000 or something like that. It doesn't do anything. They don't get strokes. But for somebody who's an older adult, that maybe their chances were only, 1 in 10, and now their chances are 10 times more. And it's a really big problem. COVID can also damage some of the other organs in the body. And if your kidneys aren't functioning well, your liver's not functioning well, your immune system isn't functioning well, that can also impact your brain function. And we see that particularly in older adults. And then lastly, if one's depressed or anxious, it can make it difficult to think. So, I often use the example, like we all know what it feels like to be jet lagged and our thinking is fuzzy, or maybe you took a old-fashioned antihistamine and your thinking is fuzzy, and or you have a headache and you can't concentrate. And usually we just sort of wait for those things to go away. But the poor, unfortunate people who've suffered COVID, sometimes they feel like that, like just all the time, and it doesn't go away, or it takes months and months to go away.
The only thing I can add to, which Andy has talked about, is obesity. We know well that certain groups who have certain comorbidities, particularly those who are obese, appear to suffer much more severe COVID. And that accentuates the process, I think, of this brain fog and the susceptibility to stroke, because you're already at risk for vascular problems. In fact, one of the things that we've been struggling with right now at Rush is myself and my colleague who's a neurologist, we have this big funding to look at the mind diet in folks who have recently recovered. They're being discharged from stroke. And we now have to deal with this issue of whether that stroke was related to COVID now. And so what's happening, we're looking at 500 individuals as they leave the hospital, and they're going to get meal deliveries with mind accordant patterns or regular. Both cases, they're also going to try to reduce calorie consumption. But for the first 3 months post-stroke is really critical in establishing the potential for rapid cognitive decline post-stroke. And we don't know what's going to happen as a result of this COVID precipitation on that. I haven't seen the literature. There probably is some studies looking at that, but not a lot in relationship and responsiveness to a diet and exercise intervention. So we'll learn a lot more in the next coming years about this, I think. But I think Andy was great in talking about the fact that the number of strokes, even in young people, have grown as a result of COVID exposure, which is terribly scary for us and how we best deal with that.
Yeah. Excellent. Thank you so much. That enlightens. So, when we think about, Holland and I just did an episode on vaccines and the stories behind vaccines and why that's important. And we weren't necessarily pro one or the other, but just hearing the stories behind that. So hearing you two talk about COVID and the after effects that we still don't know, I think is very critical. Thank you so much for sharing that.
Yeah, a new study came out within the last 2 weeks showing that a much greater percentage of people than was initially thought who have suffered from COVID have either neurologic or psychiatric manifestations. It's on the order of 30%. So it's a much higher rate than we thought. And this includes simple but actually devastating things like loss of smell, which sometimes comes back, doesn't always come back completely, as well as, mood disorders, this sort of brain fog concept, all those things.
I would like to go back to the question that I asked a little bit earlier. I said, is there anything we can do about dementia? And Christy, your first answer was, there's a lot we can do. And you talked about exercise, diet, and socialization. I suspect if I went out one street and asked 100 people roaming around my town in South Carolina, is there anything that can be done about Alzheimer's or dementia? Virtually all of them would say, no, it's hopeless. And what they mean by that is there's not a pill that prevents it or reverses it. There's not a surgery. There's not any kind of treatment. You get that diagnosis, you're done. What do you think about that? Do you think that we're looking at, when we talk about research for dementia and Alzheimer's, are we really looking at these lifestyle interventions, or is there some hope that we're going to get a medication that will prevent or reverse dementing pathology?
So maybe I'll just jump in first. So the first thing that I want to say very clearly to all your listeners is that if somebody develops memory loss, there are a lot of things that we've already talked about in these podcasts that aren't Alzheimer's that could be very treatable. Someone could have a vitamin deficiency. Someone could have a thyroid disorder. Someone could have a chronic infection that could be treated, like Lyme disease or something like that. So don't be afraid to go see your doctor. It could actually be something simple. The second thing I want to say is, although we don't have a pill that cures it, that doesn't mean we should ignore it, right? We don't have a pill that cures diabetes. We have treatments for diabetes. We don't have a pill that cures high blood pressure. We have treatments for high blood pressure. And we don't have a pill right now that cures Alzheimer's, but we have treatments for Alzheimer's. And the current medications that are available right now that I prescribe for my patients every day can turn the clock back on people's memory loss 6 to 12 months. So I can make someone's memory like it was 6 months ago, or maybe even a full year ago with the currently available medications. And the other things is that whether people are going to do a clinical trial of lifestyle interventions or a clinical trial of a novel medication or a novel technique to benefit their thinking and memory, there's a lot of things that are being developed that people might want to get involved with. There are antibodies, which are normally what the body uses to fight infections, but these are antibodies that are engineered in a laboratory to go in and either remove the plaques or the tangles that cause Alzheimer's. There's also new treatments that are looking to see if you can affect the gut microbiome. I think Christy had mentioned these, to see if those can help reduce the progression of Alzheimer's or prevent it from occurring. And there's even some studies that people are trying to induce a certain EEG brainwave and see if that can possibly reduce the effects of Alzheimer's. And then there's the type of work that we do in my laboratory, where we work on teaching people strategies to see if it can help them live more independent lives and delay them needing increased services in the home. So there's all sorts of reasons that it's not hopeless, and people should see their doctor, get evaluated. And if they want more than the current pills can do, they should consider participating in clinical trials.
Right. I have to reiterate the same thing. You have to participate in order to change the landscape. I really think that's extremely important. And I do think that, when you're concerned about your memory, a lot of times these are minor things as we age. But what's important is to seek advice from a professional. And it's also important to look at the best possible evidence out there for the kinds of things that you can change. And I really think prevention needs to be a larger focus in our medical community. And that means that our physicians and our other health professionals have to work together better in promoting preventive measures. I mean, I can remember 30 years ago when I worked with my cardiologist, I would hear the things, well, diet has nothing to do with it. Absolutely wrong. I mean, what the world of epidemiology has shown us that you can turn the clock back on individuals who are highly of their own accord practicing certain behaviors, whether it be diet, exercise, or whatever, that make them younger than the average individual. So these are things that we have control over. And again, as I stated about the diabetes, I mean, lifestyle was much more effective than metformin in people that were high risk. Once they have disease, it's a different story. But if you're at the edge, you have family history, there's so many things that you can do now and again, I guess it gets back to this issue. It takes effort. It takes effort to put that practice in and to really change behaviors. Nothing is going to be easy. But I think there's joy in doing a lot of these things. And I think the efforts that a lot of health professionals are trying to provide, like I was talking about this stroke study, what we're going to do is have walking clubs. And this is virtual or not, it's going to be a walking club so that people can be together and also facilitate that socialization that goes on. So I think there's a lot we can do, and I think there'll be more to come. I mean, just last year, we learned of a marker that would discriminate between different types of dementia in a blood sample. I mean, that is unique. That is so unique. So that means that all these other strategies may be easier tested in the future. So I think there's a lot of hope.
Yeah, and I'll just say, Christy, your story with your cardiologist is something I hear all too often today. Unfortunately, it hasn't changed as much as we would like. And that's actually the number one reason that my colleague and I wrote our first book, The 7 Steps to Managing Your Memory, What's Normal, What's Not, and What to Do About It, because we wanted to empower people with the knowledge. So when they go to their doctor and the doctor says, "Oh, Mrs. Jones, all my patients your age have memory problems, don't worry about it. There's nothing you can do if it was Alzheimer's anyways." I want them to say, "Well, doctor, it says right here on page 74 that you can't tell me that until you've done, blood tests and a brain scan and, pencil and paper, testing,
Right.
And, if their PCP is not going to do that, then they got to go find a doctor.
Go find another. Yeah, exactly. We have choices.
It's so encouraging to hear that, because, a lot of what we're talking about is pretty dire. The problem is out there, but the solution, as you were saying, Christy, is positive. And Andrew, you all have just given us reason to hope as we think about aging. It doesn't have to be this dire thing. I had 2 grandparents, both lived to be 101, my maternal and my paternal grandmothers, and, all 100% in charge of their mental faculties, and that kind of thing. And yes, maybe some of it might be some genetics. We didn't really touch on that too much, but there was that lifestyle. And so I really appreciate you all giving us that hope and that idea that participation is important to change the landscape. And hopefully we are going to get more of these medical people and the insurance people together in communities for sustainability. I know of an insurance company right now that is offering a reimbursement, a health reimbursement for things like running shoes. Yay! How about
Right. That's dynamite.
Yeah. No, and I'll tell you, I love working at the VA. And if there's any veterans out there, thank you for your service. And if you haven't visited your local VA, come on in, because we have all sorts of programs to help you move. It's called our MOVE program. We have programs for healthy diets and programs to help you achieve whatever sort of life goals you're interested in. So
awesome. Awesome. All right. Our signature question at the Afterword. And you all actually, I don't think this is going to be too difficult. Sometimes our guests pause and wonder, why are we asking this question? Well, we love pictures, and you all have given us beautiful pictures in your analogies, but what is a metaphor that helps us better understand brain health? Either one of you jump right in.
Well, can I reiterate the one I gave you before?
Yes, you can. Expand on it a little bit.
Sure. So, I really like this filing system analogy. But if you want me to expand on it and take it to the next level, so it turns out that it's not quite a filing system. It's more like a building system, okay? Because when we create a memory, we're actually like creating a structure. And then when we think about something else, we take that apart and we build up something else. And so when we're retrieving a memory, in fact, we have to sort of take the blueprint and we have to build the structure again. And if you think about this sort of building analogy, then it makes a little bit more sense as to why it can be so darn difficult to remember something. It's because you have the blueprints, but you have to reassemble the memory.
And let me say how diet might impact that. In order to do that reassembling, you have to make sure that your tools that you're using are healthy enough, right? And so that needs, and it is all about providing fuel to the brain. And there can be many different ways. Like we're right now learning for some, it could be a different kind of mix of classic carbohydrate fat. We still don't know that clearly enough, but it's how we build and reassemble that's so critical. And we have to have the tools to do that well.
Holland, these guys knocked it out of the park. Are you feeling a little smarter tonight?
I'm going to go make a salad, so I'm feeling smarter 50 years from now.
Good.
I'm going to go eat my blueberries and pecans.
That's right.
And if you live to be 101, how many podcast episodes will we have done by then? That's what I want to know as well.
And they're walking while you're listening to a podcast. That's the important thing.
Well, I'll tell you, I had to turn my computer to my other direction because normally I'm standing on a walking workstation while I'm doing all of my meetings. But I figured, for an audio recording, it'd be better to not be walking. So I'm with you on the walking.
All right. Well, this has been a riveting conversation, and I already know people I'm going to send this to and share it with, and it can help so many of us. I know people like me who do caregiving for folks with dementia. This is something that's really important. We understand what it really means to your friends and family when you become disabled with dementia. So knowing that there are things we can do, and also knowing that there are tips and tricks and techniques we can use every day to just live more effectively, live our everyday lives more effectively by maximizing our memory. It's fantastic. So, Christy, where can folks learn more about your work or connect with you?
Well, I can mention two sites. One is at Rush University Medical Center, and just Google me, my last name. The other thing is, it would be great if people went to the Alzheimer's Association and looked up US Pointer. And there's a lot of description about all those sites and all that material that's available. So I think that would be an excellent way to go about it. That's probably sufficient. Yeah.
Thank you. Andrew, how can listeners connect with you and learn more about what you're doing?
Yeah, I think the easiest way is just my website, which has everything, including my academic stuff like my CV, but it has my books. It has links to my Psychology Today blog post, my Harvard Health blog post. So I think that's the easiest. And right. As I think you have it, it's andrewbudsonmd.com.
Thank you very much. For everyone else, join us next week. We're going to be starting a new theme on global and cultural connections. We're looking forward to our conversation with two guests, one from Kigali, Rwanda, and one from Greenville, South Carolina. We'll be talking about how we impact our own circle of influence and how COVID has changed what it means to influence the world.
Yes, and thank you again, Christy and Andrew. This has been a delight to have you both on as guests at the Afterword table. We really appreciate you tonight. And those of you listening, please leave us a review, rate us on Apple Podcasts or wherever you get your podcast. Please become a subscriber to the afterwordpodcast.com. It does help us keep the conversations going. And as always, remember, you are welcome at our table.
Where we serve Mediterranean food.
Oh, that's right.
Love it. Bye, all.